Hello,
Hi,
hello.
Andy. How are you?
Good, how are you?
I'm doing well. So glad that you're here.
Are you ready for your 73 questions?
Absolutely.
All right, well, let's get started. So what is your name
Nicole Winston,
and your specialty?
pharmacy.
And how many years have you been working as a pharmacist?
9 years. I graduated in 2012.
Where did you go to undergrad
The University of Toledo.
and pharmacy school?
The University of Wisconsin in Madison, Wisconsin.
Did you take any gap years before going to pharmacy school?
Not gap years. I also have a master's degree in pharmaceutical sciences. So as a part of that, I trained and worked in a lab for several years, and then I went to pharmacy school.
Gotcha. So what was your favorite part of pharmacy school?
My favorite part of pharmacy school was probably the studying part. So one of the favorite subjects that I have was medicinal chemistry.
It is very rare people say their favorite part of school is studying. Oh, well, since you said that, what made you first fall in love with pharmacy?
So when I was a child, it was pretty relevant to me that I was interested in pharmacy. So I remember going to several of our community pharmacies around Canton, Ohio. I always wanted to know what were the ingredients in certain medications. So for instance, when my sister was young, we needed something called butt paste, and I wanted to know what all the ingredients were in. So I knew early on I wanted to be something within pharmacy.
Gotcha. So for those who may want to be in your shoes one day, how long does your training take after undergrad?
So for someone who wants to be a pharmacist, you can there's two different routes. You can do 2 years of pre-pharmacy and then go directly into a doctorate of pharmacy program. Nowadays, most students get a 4-year undergraduate degree and then go directly into pharmacy school, which, depending on the program, can be from 3 to 4 years.
Okay. So are there any further subspecialties you can do within pharmacy?
Yes, absolutely. So many pharmacy graduates go on to do a residency. It's not required like medicine, and they can specialize in things like pediatric pharmacy, cardiology, critical care. So they can specialize in that beyond. They can also do fellowships if they want to specialize even more.
Okay, that's good to hear you have a ton of options. Did you ever consider getting any other degrees like an MBA, MPH, or even a PhD?
Yes, so I also have a doctorate in education. So most of my day is typically teaching right now, but I did receive a doctorate in education from Marshall University in Huntington, West Virginia, where I specialized or concentrated in culturally responsive teaching.
Okay. So what would you say is the most unique part of your field?
Is that we are the drug experts. So we know everything from obviously how the drugs work, but also how they come, the formulations that are available. Those who work in hospital pharmacy a lot of times have to work with drug shortages, so we're the people who can help individuals get the drugs that they need, even if there's particular drug shortages. And we're also in the communities. Sometimes we're considered the most accessible. If you think about your small towns, even here in Georgia, sometimes the pharmacy is where people go just for basic medical questions. They'll go and talk to their pharmacist.
Okay, that's good to hear.
Yeah.
So I always let everyone kind of be a car salesman about their career. So why should someone choose a career in pharmacy?
Well, there's a lot of flexibility, as we talked about. There's a lot of areas to specialize in, and that's even expanding now. I mean, when I graduated in 2012, there's probably a handful, but now there's up to, I think, 13 different specialties you can go into. Also, those who are really interested in chemistry, but also want that patient care aspect, because that was me in particular, pharmacy is a great thing to go into. So you have that balance of, being the drug information expert, but also being able to continue to take care of patients and see the outcomes that you would have in your community.
Gotcha. Play devil's advocate now. Why should someone not choose your specialty?
Sure. I guess there is a lot of chemistry as a part of the, both the undergraduate part and pharmacy school itself. So you would have to be, if you're not that great at it or it's not your favorite subject, it may not be a part that you want to go into. Also, it's really difficult to get a residency. So there's currently about 2,500 or so residency spots in the United States and about 12,000 graduates each year. So it's pretty difficult to get that in. So if you have a residency and you were able to get in there, that really boosts your chances of getting into the area that you really want to practice in.
Gotcha. Now to elaborate a little more, what would you say is the most unique part of pharmacy?
The most unique part, I guess, is our niche, I guess, would be drug formulations. So obviously I've talked a lot about that we are the drug information experts, but for myself, we also have kind of a component where we do compounding. So let's say there's a particular drug that isn't available in a dosage form that you need. Clinicians, physicians can write prescriptions, and many of your local pharmacies can compound it in a way that you can. So for instance, I used to teach pharmaceutics, so I can still roll suppositories, punch capsules, make creams and ointments. So that's kind of our niche, I guess, in pharmacy.
All right. Now, I know you only had my CBO group for a couple weeks. You were a preceptor, but it is obvious you have a great passion for education. Mm-hmm. So what would you say is your favorite part of teaching students?
I love when I see kind of the light bulb go off. So I understand as a part of medical school, pharmacology can be one of the most difficult subjects to conquer. Mm-hmm. Pharmacology is its own language, so there are no rhyme or reason sometimes for why drug companies name the drugs the way that they do. So I am very passionate about being able to transform kind of a difficult language into something that can be understood by medical students so that they have that platform. So as they go on to clerkships and on to residency and become attending physicians, pharmacology doesn't seem as difficult as it once was.
Now, specifically, since you teach at a medical college, what is your favorite part about interacting with medical students?
My favorite part is how passionate they are about the areas that they want to go into, the passion that they have for helping patients. Also, just the backgrounds that they have. Not every medical student is a biology or a chemistry major. So I really love to learn and about their stories and help in any way that I can help them get to where they want to go.
All right. Well, since we are in the simulation center.
Yeah, let's go ahead and take a look. This is what I enjoy to do as much as I can. All right. So I'm going to take you into one of our simulation rooms. So one of the hats that I have is I'm the assistant director of pre-clerkship simulation. So when I first started here at Augusta, I started working closely with Dr. Matt Tews, who is the head of our simulation center, and he brought me in really early on to help design simulations that help students practice as a part of both the pre-clerkship and also a lot of the clerkship education that we have. So this is a typical simulation room. These are what we call high fidelity mannequins. Okay, so they look pretty human, and what's nice about these, students can practice listening for breath sounds, heart sounds. Usually we have a monitor going that gives things like all of the vitals, so your oxygen stat rates, your blood pressure, your heart rate. And as a part of these simulations, we generally build in something that changes. So if you have a patient that presents with shortness of breath, if the students are able to work through and figure out that it's an asthma exacerbation and they give albuterol and oxygen, once that happens, the vitals improve. So they see changes in real time once they apply the appropriate management.
Yep, definitely really cool.
Yeah.
Now, I know you spend a lot of your day teaching, but what does an average day of a clinical pharmacist look like?
Sure, so I'll take you over this way. So in the hallway, we have some of the areas that pharmacists, as a part of being a staff pharmacist, a lot of times they'll stock what we call Pyxis machines. So this is kind of generally what a Pyxis machine would look like in a hospital. So pharmacy a lot of times will stock these, and this allows for nursing and other staff to access medication during the day or even during the night when someone may not be there in case their patients need it. As a part of a clinical pharmacist, they are a part of the healthcare team. So they round with physicians, nurses, respiratory therapists. They see the patients. They help take really great detailed medical histories. They make great drug recommendations based on what the patient has. They adjust dosing a lot of times. So one of the medications that you all learn as a part of medical school is vancomycin. Many times you have a pharmacist behind you making sure to adjust the medication based on levels of that particular medication, and we do that for several others. Also, as a part of the day, once your patient is finally ready to be discharged, pharmacists normally will work out what we call medication reconciliation, where they match what the current medications they came in with, what the current medications they're on, and match those up so that when they're discharged, there's not duplication and they're not taking the inappropriate medications for that patient.
Okay. Well, to elaborate more on that, do you get to interact with patients at all?
Not right now. As in my previous institution, I did work a bit, both as a ambulatory pharmacist and a little bit as a clinical pharmacist. And yes, I had the opportunity, and the hope is here really soon that I'll also be able to work a little bit as a pharmacist at our medical center next door. But yes, I've had lots of experiences with patients in the past, as I said, both in more of an ambulatory or retail setting and within a hospital.
Okay. And I know you touched on it a little bit earlier, and I know it's going to be important to me and many people watching. So what is your typical interaction with physicians or residents?
Sure. So for myself, this is where pharmacy can shine. That's really working with, being able to adjust doses appropriately in a hospital setting like this. In an ambulatory setting, pharmacists can work in a clinic. They can help with the medications, figuring out the best medication for that particular patient. Many times it's also figuring out which medication is the least expensive that will give you the highest possible outcome. So that's what a lot of our ambulatory pharmacists do. And really with residents, we're just working as the team, and we are your resource for drug information. So any type of drug question that you have, feel free, reach out to your pharmacist. Pharmacy residents and even pharmacy students, a lot of times they'll be able to get you the information that you need.
Well, speaking of questions, what is the most common question you get asked by residents or physicians?
Probably drug interactions. So, and I know that's kind of a broad question, but that's one of the areas that, once again, we specialize in. There are so many drug interactions that are that we have, and that has to do with whether or not they go through what we call our CYP enzymes, or is there some type of interaction that happens as a part of the digestive process. So pharmacy students, and then as they go on with their training, they know where to look in terms of finding out whether or not we can, look for that particular interaction. So I would say drug interactions are probably the most common.
And then what is the weirdest question about a drug you've been asked by a physician or resident?
Physician or resident, I don't have one for a physician or resident, but I actually have one from a patient, if that's okay. So when I was working as it was actually an intern. So for pharmacy students, we actually do our internship during our pharmacy school period. And I was working at Walmart, and I had a patient come in asking me really specific questions about fungal medications, antifungal medications. And I mean, it was almost like pimping. And it was in the, over-the-counter area at Walmart. And I eventually came to understand that he was actually in a clinical trial for antifungal medications. So I understood why this patient kind of off the street was asking me very specific questions about antifungal medications.
Okay. What is the most common drug you see prescribed?
Okay, so it really depends on where you work, but overall, antihypertensive medications are usually the most prescribed. I would say things like ACE inhibitors. So your common, lisinopril is probably the most common. Another one that we do dispense a lot is metformin. So you commonly see that in your type 2 diabetics. So I would say both of those are probably the most common.
All right. What's the rarest drug you've seen prescribed?
Oh, the rarest drug. Oh my goodness. I would say, good. That's a good question. The rarest drug, here, let's walk over this way. I would say the rarest drug, ooh, probably any of your oncology medications that are specific to rare, rare types of cancers. I can't name one off the top of my head, but those are relatively rare.
Well, along with that, what is the hardest drug name to memorize?
The hardest one to memorize, actually to say would be dexmedetomidine. So it's one of my favorites to say, commonly used in protocols for sedation purposes, but it's one of the best, but it's a very, very long medication name.
Hardest drug mechanism to understand?
Let's see, the hardest drug mechanism to understand. Oh gosh, that's a good question. Probably some of, not necessarily hard to understand, but there's a lot of them. So when you think of antibiotics, you would mainly think, oh, they probably, affect bacteria in the same way. But so many of them have kind of unique aspects, whether or not they interact with, RNA synthesis, or they actually poke holes in the bacterial wall. So I would say antibiotics probably, maybe not the hardest to understand, but the broadest and kind of the most unique in terms of how they work.
Gotcha. So what's the toughest part of your job?
Well, for me, as working as a part of in academia, the hardest part is if I'm not, no matter what I do, if there's simulations, if we design cases for case-based learning, if I'm not able to reach a particular student and help them understand, sometimes I don't necessarily take that personally, but I feel defeated in a way, because I really do want them to be able to understand the basics of pharmacology so that they have, like I said, that backbone and that platform so that they're able to be really successful as a part of their career.
Gotcha. Now flip it around in a more positive light. What is the most rewarding part of your job?
Oh, I love being around students. I get my energy from them. Naturally, I'm a bit of an introvert, so I love the energy that students have. I joke with my husband, I actually sometimes, as a part of the summer, I get a little bit depressed because I'm not around students as much as I normally am. So I would say the best part of my job is just interacting with students and seeing you all learning and being a small part of your journey in becoming a physician.
All right, so I got a couple of quick fire questions for you, but
Sure.
very important questions.
Yeah.
So how many hours do you work in an average week?
So as a part of the curricular redesign, it does take a little bit more time than I'm normally used to. So I would say between 50 and 55 hours to make sure that we are able to launch everything for you all.
What time do you normally wake up?
Right around 6 a.m.
What time do you normally leave the hospital, or I guess in this case, the office?
Around 5:30.
How many hours of sleep are you typically working on?
I try to get 7. If I can, on a good night, I may get 8 hours.
How many hours of sleep are you working on right now?
Probably about 6. Sundays are always the hardest.
Do pharmacists have to take call at all?
Yes, absolutely. And that generally happens, for pharmacy residents, they'll experience that, but also what we would consider kind of a specialized pharmacist will typically take call.
Yeah. You a night or day person?
I am a day person. I don't last very long into the night.
Do you have to chart at all?
Chart. Yes, I did as a part of, not what I do right now, but yes, absolutely. And that has to do with, once again, our specialty and making sure that we write notes appropriate for the medications that we help with.
Okay. So who are you most thankful for on your patient care team, or I guess in this case, just the academic team in general?
Sure, who am I most thankful for? I am thankful for all of the people who kind of took me under their wing when I first started here. People like Dr. Fisher, Dr. Tai, Dr. Wanda Giroux, Dr. Shilpa Brown. These individuals kind of were really excited to have a pharmacist on board, and they wanted me to be integrated into the curriculum as much as possible.
So why is the pharmacist so crucial to adequate patient care?
We are the individuals who make sure that the right patient gets the right dose at the right time. So, we are there to make sure that particularly medical errors that are associated with medication are reduced or possibly eliminated as much as we can.
What's the most common medical advice you give to your patients?
To always, if there's a problem, with you getting the medication, because as a part of our healthcare system right now, sometimes it's incredibly expensive for individuals or patients to have and be prescribed certain medications. If there's ever a problem, please go see your pharmacist. There's a way to work through it. There may be another generic alternative that we can switch you to. So it really is, if you are having trouble affording medications, go see your pharmacist or talk to your physician. We can collaborate together and we'll be able to get you the medication that you need.
All right, so we've talked a lot about your life inside the hospital and the workplace. How about your life when you clock out? So what is your favorite thing to do when you're not working?
I love spending time with my family, especially outdoors. So I have 2 little ones, Violet and Miles. They're 6 and 4. So as much as we can, we're outside, although sometimes in the summer it's a little sweltering, but we try to be outside as much as possible.
Does your family ever ask you for random medical advice?
A little bit. I get that. I do get that a bit, especially, what can they take their medication with? That's probably the most often question,
Yeah.
most common.
What's the weirdest question a family or friend has ever asked you?
Not necessarily weird, but it's, it's one of the things that it's just misunderstood. So misinformation, does the influenza vaccine actually give you influenza? Does the COVID vaccine actually give you COVID? So those are probably the most common ones I get from my family. And it's nice because I can kind of explain through them to reduce the amount of misinformation that's out there.
Any pets?
Yes, 2 cats, Jackson and Chester.
Favorite animal, not a dog or cat?
I would say an elephant. I think they're so adorable.
Nice. If you could have dinner with anyone in history, who would it be?
I would actually have to say my mom. So she unfortunately lost her battle to breast cancer in 2015. So if I could have a chance to have dinner with her, I think that would be absolutely amazing.
And what would you guys be eating at that dinner?
Oh, her favorite was stromboli. She made this fantastic stromboli, so we would definitely have that.
Now, what is your favorite dish to eat?
I love fajitas, so I would say
Good
probably,
choice.
that would be my best.
Any favorite restaurants around here?
We love Poblanos. That's probably one of our favorites. It's a restaurant out in Evans, so we enjoy eating there.
Coffee, tea, or soda?
I drink all 3, but I say tea is the best, unsweet tea.
Okay. How much water should you be drinking every day?
At least 8 ounces. I know I don't do it. I need to be doing more of that, but yeah, absolutely.
Favorite meal from the hospital cafeteria, if you have one?
Sure. Even though I'm not a vegetarian, anything like vegetarian burger or veggie burger, so probably something like that.
Favorite healthy snack?
Any type of mixed nuts, so cashews, almonds, things like that.
Favorite guilty snack or cheat meal?
Good old Ben and Jerry's. I love many of the flavors, but any of the kind of cookie dough flavors are great.
Great choice. Pineapple on pizza, yes or no?
I would eat it, but not a big fan.
Any artistic hobbies you keep up with?
So I grew up, probably starting about 5th grade playing the trumpet, and we actually got it out this weekend, and I had my kids buzz their lips a little bit. So so I still played the trumpet, was in marching band, so really enjoyed that.
Any artistic hobbies you keep up? Oh, no, I just said that. Top 3 music albums.
Oh, music albums. Okay, so my first would be Soundgarden, Super Unknown. Absolutely love that. Seven Dust's Animosity. And then probably Pink Floyd, The Wall.
One random task you wish you could be better at.
Probably, let's see, one random task, probably just organization. I mean, overall, I'm typically organized, but as pieces and parts we're building as part of the curricular redesign, there are probably times that I could have been a little bit more organized.
What's the best way you relax after a long day?
Probably just once again hanging out with my family, going outside for a bike ride.
Night in or go out on the town kind of person?
Probably night in. Maybe in another life I was night out, but definitely night in now.
Indoors or outdoors?
Outdoors for sure.
Beach or mountains?
Beach for sure.
Would you consider yourself more of an introvert or an extrovert?
Definitely an introvert because I get exhausted by the end of the day, but I do absorb energy from all of you wonderful students.
And was that personality trait a factor in you choosing your career?
Probably. Pharmacists, generally are a little bit more introverted as a part of, the patient care aspect, but yeah, probably.
Okay, we are really close to the end.
Mm-hmm.
Only got a few more questions left, but these will
Sure.
be more reflective questions.
Yeah.
Right? So, I can't read and my coffee is wearing off. What did you think you were going to be when you grew up as a kid?
So I love to tell this story, and I'll be really quick. So when we were in 6th grade, one of our science fair projects actually did the dissolution of pain-relieving medications while other people were making volcanoes and things. So I knew early on I probably wanted to do something in pharmacy, but there was a time that I thought I might go into something like chemical engineering, but I eventually made it to pharmacy.
Is there a different healthcare career you think you could have done?
I might have been able to be a physician. I think what deterred me a bit is I don't do well with blood. And I realize now that there's specialties I could have gone into, but I still have a really, big passion for medications.
Now, if you weren't in medicine, what do you think you'd be doing right now?
Possibly in engineering somewhere, chemical engineer, just not working for something like an oil company.
Gotcha. Now, were there any times you doubted you would make it as a pharmacist? Because I know whatever healthcare career you choose, especially in pharmacy, it's not easy.
Yeah. I think I didn't necessarily have doubts, but there were times where some of the classes that we had to take I didn't connect with as much, and they typically were more of the management. So a lot of times for pharmacists, they have several management courses that are taken because so many of them either own their own pharmacies or work for larger corporations. So I didn't connect well with the material. I got through it, but I didn't connect really well with it.
Gotcha. So if you could change one thing about the medical field right now, what would it be?
If I could reduce the cost of medication, I wish I could do it with just the snap of my fingers. So there's a lot of work we need to do here in the United States, specifically with the cost of insulin and some life-saving medications. So if I could change that, I would.
What can a pre-med or pre-healthcare student in undergrad do right now to prepare to go into pharmacy?
So a lot of it is just, and it looks very similar to what you would consider for medical school, so a lot of chemistry and biology. Also, if you can, shadow a pharmacist, whether they're working at a retail pharmacy in your community or if you're able to shadow pharmacists working in the hospital or in ambulatory clinics, just take those opportunities if you can.
Now, if you were to go back, would you change any of your experiences that got you to where you are right now?
No, I don't think so. I took a little bit of a winding path until I got to this place working at a medical school as a pharmacist, but I don't think I would change it because I'm not sure if I would be here if I hadn't had all of those experiences.
Well said. And now we are at question 73, the last one. Finally, what would you say to the aspiring pharmacist right now?
To not be deterred by some of the outlook in terms of our career. I know sometimes there's a lot of pharmacists who are graduating right now, but there are still many opportunities in pharmacy, and I think it's one of those fields that's changing really quickly. So don't be deterred by necessarily the number of job opportunities right now. I really think, over the next few years, we'll see a lot of great career opportunities for pharmacists.
All right, well, Dr. Winston, that is all I have for you. Thank you so much for sharing.
Thank you.